An advance directive is a healthcare document that explains how you would want medical decisions to be made when you're too ill or unable to speak for yourself. It guides healthcare providers and loved ones on what measures you would want taken in a medical crisis. Do you have an advance directive? Would your loved ones know and understand your wishes if they were asked to speak for you? Only about 37% of Americans have an advance directive. In Tulsa County, only 17% of people have an advance directive. When surveyed, about 1/3 of people didn't even know where to begin. Now more than ever, it's important to have an advance directive outlining your wishes should you become too ill to speak for yourself. Imagine a loved one having to make critical decisions for you in an emergency. Imagine you having to make those decisions for a loved one. It's important to think about, to talk about, and to document. To bring awareness to advanced directives and advanced care planning, Clare House created Tulsa Healthcare Decisions Day in the spring of 2020 and partnered with 8 organizations across the city. Inspired by National Healthcare Decisions Day, THDD is a collaborative initiative on April 16th to encourage Tulsans to take action by documenting their wishes and engaging in conversation with family and friends. THDD features a screening of Your Voice, Your Wishes, Your Advance Directive, a comprehensive video guide to completing the Oklahoma Advance Directive for Healthcare. Following the video, local experts lead an interactive Q&A and are available for questions and assistance in completing an advance directive. THDD will benefit our community by reducing the number of people receiving unwanted treatment or treatment in conflict with their wishes, lessen a loved one's stress of making emergency end-of-life decisions for another, and relieve regret felt by our healthcare providers. In 2021, we hope to partner with Tulsa groups and organizations to safely host a citywide event, providing the resources and information needed to encourage Tulsans to complete advance directives. If you don't have an advance directive, please consider completing one. When you share your advance directive and wishes with loved ones, encourage them to complete one. It is a gift you give each other. For guidance on completing an advance directive, you can view Your Voice, Your Wishes, Your Advance Directive on the Clare House YouTube page. To download an Oklahoma Advance Directive for Healthcare, visit okdhs.org and search Advance Directive. If you're interested in participating in THDD as a community partner, please contact me. Our goal is to make THDD an inclusive citywide event every year. Help us raise the 17%.
All right, so apparently the stream is working perfectly now. So for the 17 people that stuck with us, thank you. Let's bring on Britni. Hello, Britni.
Hi.
So, all right.
No pressure, but it does seem like the stream is working now.
Yeah, so
great.
everyone is going to hear what you say, unlike any of the other guests we've had so far. So,
Listen, the previous ones were working periodically, so they heard some of what they were saying.
That's true. That's true. So, Britni, where did this idea come from?
So the idea of Tulsa Healthcare Decisions Day came from National Healthcare Decisions Day, and it was started by the Conversation Project. And the idea was something that we wanted as Clare House to get out to the community and to participate in that national movement. And so we talked about it a little bit. We had been aware of National Healthcare Decisions Day, and we wanted to bring that sort of energy surrounding advanced directive and advanced care planning to our community. So it was sort of a national movement already, but we wanted to participate in that as a local community. And with Clare House, we are a community home for people who are dying, and we support them throughout the final days and weeks of life. And we do that free of charge. And what we want is to impact the community outside of Clare House. We only have 10 beds and we can only care for 10 people at a time. So we wanted to provide this information to prepare people for these situations, for end of life situations, but not only that, for emergencies, for accidents, for medical crisis, for illness. And so we wanted to give them the resources that they needed to make these decisions. And so that all of that kind of came together to create this idea of bringing that national movement to Tulsa.
So this is obviously a tough, sometimes uncomfortable conversation to have. So what do you say to people to encourage them to kind of push through that and have these tough conversations?
I think what makes it a little bit easier, sometimes if you're watching TV and you see like a show or a movie and something happens in that situation and you have your partner or your family sitting next to you, you can just say, if this happens to me, I would want this in that situation. And it kind of makes it a little bit easier to introduce that conversation because you're right, it is pretty hard, especially if you just jump right into it. So I think easing into it kind of helps a little bit. And really just kind of putting things in perspective. We plan for pretty much all aspects of our life, whether that's a new job, a baby, moving. And so I think planning for an accident or planning for end of life, that's also equally as important. That's also a part of life. So I think just really putting it in perspective and just understanding that, like the video said, it is a gift that you give others and that you give your family by taking that burden away from them.
Is this something, I'm always curious where ideas come from. Is this something that you experienced and were looking for resources that you couldn't find? Was this something you saw somebody else go through?
I think with the work that we do at Clear House, we see that every day. We have families that come in, and one of the main things that we hear over and over is, if I would have known about this, or if I would have known this existed, then I would have done things differently, or I made different decisions. And so our work at Clear House, I think, really inspired this movement. And I had a loved one that died at Clear House, and it was special, and we had information that we needed. And so it was, I think, important from a personal perspective, as also from a professional perspective, to really just try to get people to engage in this conversation.
You also mentioned that there is, with this day, there are professionals available to help with Q&As and stuff like that. But what kind of help do they provide for somebody who's trying to put together this?
So the professionals that we work with are anywhere from physicians to different levels of nursing to people that have had years of experience in end of life care and working and communicating with families. And so they provide assistance with if there are more specialized questions that weren't presented in the program, or if they want special scenarios, like if they have questions with specific scenarios, like if this happens, then physicians are required to do this. So just things like that, just really technical questions, and then just support, really.
So what do people do in between Healthcare Decision Day 2020 and Tulsa Healthcare Decisions Day 2021?
So we have the video on YouTube, the Your Voice, Your Wishes, Your Advance Directive, and that is a really helpful tool. When we first started talking about Tulsa Healthcare Decisions Days, how were we going to format the program? And something that was really important to us was creating this easily accessible resource where people can just jump online and they can literally sit down wherever they are, and it walks them through the advance directive and they can fill it out right then. So that was really important to us as a first step, because there's nothing like that exists as far as we know in the state of Oklahoma. The advanced directive is written at a sophomore in college level of understanding. So it's just, there's lots of barriers that surround that. And so I think our main goal was to create a resource to break those down a little bit. So in between the years of Tulsa Healthcare Decisions Day, you can go on and watch the video and fill out your own advance directive and have that conversation with family and friends, because it's important to not only have that documentation, but to also have that conversation with your family.
Well, thank you, Brittany. I know this is one of those projects where it's not fun necessarily to do, but it is important and needed, and I appreciate it. And I want to thank you, and hopefully for the people watching, they watch your video, they go to the site and get the information they need. So thank you so much.
Yeah, and if people are interested in participating as a community partner in 2021, we'd love to reach out with you. So,
All right, excellent.